Medicare doesn't make any sense, so we're here at Healthcare Solution Direct to make this as simple as 1, 2, 3. We're going to talk right now about everything that you need to know to enroll into Medicare. So let's first talk about this. If an individual is needing to enroll into Medicare at 65 or older, it can be very, very stressful. We know that because we talk to lots of beneficiaries. We talk to thousands of beneficiaries that are turning 65 or going on to Medicare, and we understand how stressful this can be. So this section will focus on step-by-step what an individual needs to do in order to enroll into their Medicare Part A and Part B. This is going to be very, very useful. Enrolling into Medicare should be a one-time event for someone who's eligible for Medicare. Once it's done, it's done. So the individual does not need to renew their Medicare coverage every single year. So once enrolled in Medicare Part A and B, they're now in the Medicare program. That stress is gone. But enrolling into Medicare will only be stress-free if an individual knows exactly what they need to do. And that's the purpose of this video right now, is to show you exactly what you need to do. So after you're done with this section, you'll know exactly what needs to be done in order to simplify the Medicare enrollment process and do what? Make it as simple as 1, 2, 3. So let's first talk about who's eligible for Medicare. So let's get the foundation down. Before we look at the Medicare enrollment process, it's important to go over who's eligible for Medicare. We can then look at who gets Medicare automatically and who must enroll into Medicare, so we can separate the two for those that get it automatically and for those that actually have to enroll, and we'll walk you step by step through that. So here are the requirements needed in order to be eligible to get Medicare Part A and Part B. There's 4 requirements. The first one is you're 65 or older. So currently, as of July 2021, you must be 65 or older, or you are disabled, or number 3, you have end-stage renal disease known as ESRD, and the last one, number 4, is your diagnosis of Lou Gehrig's disease, ALS. So let's look at each one of these 4 individually so that you really understand the requirements in order to get Medicare Part A and Part B. So someone that's 65 or older, the majority of those that are first eligible for Medicare will fall into the category of age 65 or older. So in the insurance industry, when someone's turning 65, these individuals are often referred to as T65, which means turning 65. So if you see some things on there that say T65, it's referring to somebody that's turning 65. There's 10,000 people a day during what many refer to as the silver tsunami that are turning 65 every single day that will continue until 2030. So when someone's turning 65, no matter what their current insurance is at that time, they will have the option to enroll into Medicare Part A and Part B when they turn 65 years old. So there are simple requirements for Medicare at 65 or older. So here's the only requirements that the Centers for Medicare and Medicaid Services have in place when someone's turning 65 or older. That individual, number 1, has to be 65 or older. Number 2, the individual is a U.S. resident. Number 3, the individual is a U.S. citizen. Or number 4, the individual is an alien who's been lawfully admitted for permanent residence and they've been residing in the United States for 5 continuous years prior to the month that they're applying for Medicare. So again, if someone is a permanent resident in the United States and they've been here for 5 years, then at that point they can apply for Medicare Part A and Part B. So let's talk about a little bit more about the requirement of permanent residence for those 5 years. The last scenario of the requiring permanent residence in the United States for the last 5 years is typically when a family moves over a parent from another country to live with them permanently. So once that family member has been admitted for permanent residence, it kind of starts that clock where 5 years later they can go ahead and buy into Medicare. So this would be a really good example of an individual that would fall into the 1% of having to pay for their Medicare Part A. So remember, Medicare Part A is typically free to everybody. It's called the Premium Free Part A. But if you need to purchase Part A, please be sure to watch our video on Part A cost. So we break down exactly what it would cost to be able to purchase Part A if you fell into this scenario. So the second individual that can apply for Medicare is someone that's disabled. So in order to get Medicare prior to the age of 65, you must qualify based on permanent disability. So an individual must apply with Social Security and be granted what is known as Social Security Disability Insurance, SSDI. This means that they're asking the federal government to pay them a benefit each month because they're permanently disabled and can no longer work. work. So let's talk about that a little bit more. Let's talk about Social Security's determination for disability. So Social Security will only pay out benefits if they have determined that an individual cannot work due to a disability for at least 1 year, or it will result in their death. So Social Security will use the following basic requirements to determine if someone could qualify. Again, there's a lot more that goes into it, but here are 5 things that they look into. So they look into if that individual is still working. Are you working? Number 2, is your condition severe? Number 3, is your condition found on a list of disabling conditions? Number 4, can you do the work you previously did? And then number 5, can you do any other type of work? So those are the 5 things that Social Security will look at and when they're looking to go ahead and give someone SSDI benefits. In order to get SSDI, this is a lengthy process, as doctors and disability specialists must be involved in making sure that the individual is unable to work and perform the basic duties of lifting, standing, walking, sitting, or they have a cognitive issue that affects their impairment. So Social Security does not offer short-term disability. So I want to repeat that. Social Security does not offer short-term disability. They only offer total permanent disability. They're making the decision to financially take care of the individual because they will no longer be able to contribute to the workforce. So that's the key thing with Social Security. It's a permanent that they're looking to go ahead and hand out. So once granted disability, Medicare is not immediate. So this is really a key thing to understand with someone that is disabled, that's under the age of 65, is that once someone is granted permanent disability, they'll begin to receive Social Security Disability Insurance SSDI benefits each month after a 5-month waiting period. So here's how it works. Social Security will go ahead and grant someone SSDI, Social Security Disability Insurance. Those benefits will then start 5 months later. There's a 5-month waiting period before that first check gets deposited into that individual's account. SSDI will be paid on the 6th month after the date that the disability was approved. Medicare, though, however, will not be automatic for that individual that first month when they start receiving those SSDI payments. So here's how it works. Social Security has what they call a Medicare waiting period of 24 months of SSDI benefits before someone would qualify for Medicare Part A and Part B. So once someone has received SSDI benefits for at least 24 months, their Medicare Part A and Part B will start for them automatically on the 25th month. There's nothing that that person has to do. The Medicare card will arrive in the mail about 3 months prior to that effective date of the 25th month of the SSDI benefit check being deposited. The individual does not need to apply for Medicare. It will be automatic for them. Here's the third way that someone can get their Medicare A and B for end-stage renal disease known as ESRD. So someone will qualify for Medicare if they have end-stage renal disease, ESRD, that's going to result in permanent kidney failure that will require them to have dialysis or a kidney transplant. So an individual that meets these requirements will need to apply for Medicare A and B. Again, you're going to need to apply for Medicare Part A and Part B. It will not be automatic just because they received the diagnosis of end-stage renal disease, ESRD. So let's talk about right now what the requirements are for ESRD in order to apply for Medicare. So here's the general guidelines and rules to get Medicare started when an individual meets the ESRD requirements. So if an individual is receiving dialysis at an inpatient or outpatient facility for at least 3 months, they're eligible for Medicare on the first day of the 4th month of treatment. The second thing is if an individual decides to begin an at-home dialysis program, they may be eligible for Medicare on the first day of the month that their program actually begins. And the last thing, number 3, is if an individual is receiving a kidney transplant, they're eligible for Medicare starting on the first day of the month that they'll be admitted to the hospital for that transplant. So if the kidney transplant is successful, their Medicare will actually end 36 months after they have the kidney transplant. It's not going to be permanent. If the kidney transplant is successful and there's no issues, then at that point, after 36 months, they would lose the Medicare, their Medicare A and B benefits. But if you have any questions about the ESRD, that's what we're here for at Healthcare Solutions Direct. We know this can be complicated for those that are being diagnosed with ESRD, so please give us a call so that we can talk to you about that and make sure that you're doing the right thing as far as applying with Medicare. That's what we're here for, to help make this really, really simple. Again, simple as 1, 2, 3. So let's talk about the fourth way that someone can get their Medicare Part A and Part B benefits, which is if somebody is diagnosed with Lou Gehrig's disease, ALS. So it's called amyotrophic lateral sclerosis, ALS, which most refer to as Lou Gehrig's disease. This would be considered a permanent disability according to Social Security. So an individual would still have that 5-month waiting period before receiving that first Social Security check, but there's really, really good news for that individual. After that 5-month waiting period, what's different about this type of permanent disability is that the 24-month waiting period for Medicare is waived. Medicare will start the first month that that individual begins to receive their Social Security disability insurance benefit payment. So as soon as that first check is deposited into that individual's account, because they were approved for Lou Gehrig's disease, ALS, according to Medicare, their Medicare would actually start that first month. So the Medicare card will arrive automatically in the mail, again, about 3 months prior to the effective date of the first month of SSDI benefit payment. So again, here are the 4 ways that someone can get their Medicare A and B. They can get it if they're turning 65 or older, or if they have permanent disability according to Social Security's requirements. They have been diagnosed with ESRD, or lastly, they've been diagnosed with ALS, Lou Gehrig's disease. Again, if you have any questions about that, I recommend that you watch this video again, or be sure to call us here at Healthcare Solutions Direct so that we can make sure that you're doing the right thing when it comes to your Medicare coverage.